Liz?
Good morning, everyone. My name is Elizabeth Leone, and I am the chairperson of the New York City Local Early Intervention Coordinating Council. I'd like to welcome you all to our web-based LEICC meeting. New York City's local law number 103 and the New York State Open Meetings Law require open meetings to be both webcast and archived. This meeting is being recorded today. I will now review the procedures for LEICC meetings. For in-person LEICC meetings, attendees should pre-register on the NYC Department of Health Early Intervention LEICC webpage. For web-based LEICC meetings, attendees will find the link on the New York City Department of Health Early Intervention LEICC website. Meetings are open to the public, but the audience does not address the LEICC members during the meeting. For the web-based meeting, we will not be using our chat or our Q&A features. For this web-based LEICC meeting, members of the public were asked to submit their written public comment by emailing embeddedcoaching@health.nyc.gov. Public comments will be read into the record at the end of the meeting. LEICC members will raise their hands instead of raising their cards to make comments. LEICC members should keep their cameras on during this meeting. Transcription is available for this meeting. Written meeting minutes will also be available. Have the LEICC members introduce themselves, and we will start with Commissioner.
Good morning. My name is Lydia Ledniak, and I'm the Assistant Commissioner for the Bureau of Early Intervention, and I will pass it over to Patricia Gray.
Thank you, Lydia. Good morning. Welcome. My name is Pat Gray, and I am the representative from the Academic Partnership for the local New York City BEI. Thank you.
Roseanne?
Good morning. My name is Roseanne Saltzman. I am formerly the program director at Up We Grow. I'm currently staying on to do some special projects.
Great. Trish?
Good morning. My name is Trish DeVito. I'm from the New York City Department of Ed and a CSE Committee on Special Education chairperson.
Chris?
Chris Tan, Assistant Commissioner for Education Initiatives here at ACS.
Great. And I think that is all for committee members. We had a couple of committee members who couldn't attend. Let us also introduce our panelists, so our presenters for today. Carlos, would you like to introduce yourself?
Hi, good morning, everyone. My name is Carlos Rosales. I'm the Senior Community Engagement Associate at Citizens Committee for Children of New York. I'll share more later, but glad to be here.
Thank you. Channing?
Hi, everyone. Can you hear me okay?
Yes.
Yeah. Okay, great. Hi, everyone. I'm Channing Edson. I'm the Senior Director of Early Intervention, Special Education, and Inclusion here at the Division of Early Childhood Education.
Thank you. David?
Good morning, everyone. I'm David Harrington, Executive Director of United for Brownsville.
Welcome. Danny?
Good morning, everyone. My name is Danny Herring, and I am the Early Intervention Ambassador with United for Brownsville.
Thank you. And who do we have next? Let's see. Jeanette?
Sorry, I had trouble unmuting myself. Hi, good morning, everybody. I'm Jeanette Gong, Director of Intervention Quality Initiatives at the Bureau of Early Intervention.
Good morning. Mary Elizabeth?
Hi, Good morning, everyone. My name is Mary Vachon, and I'm an evaluation specialist on the research and data team here at the Bureau of Early Intervention.
Good morning, Nora.
Good morning, Nora Puffett, Director of Administration and Data for Early Intervention.
Good morning, and Vanessa.
Morning, everyone. I am Vanessa Burrell-Warner, Physician Liaison, Outreach and Training Specialist here at the Bureau of Early Intervention.
Great, thank you so much. Liz?
Hey, thank you, everyone. And today I am happy that Dr. Leslie Hayes is joining our LEICC meeting. I'm going to just give a little introduction for Dr. Hayes. Dr. Leslie A. Hayes is the Deputy Commissioner of the Division of Family and Child Health, FCH, in the New York City Department of Health and Mental Hygiene. Dr. Hayes leads FCH in creating and overseeing programs, policies, and services that support health equity, social justice, safety, and well-being for families and children. Dr. Hayes is a pediatrician who has dedicated her medical career in delivering quality health care, primarily in underserved New York City communities. Her strong belief in the power of the family unit to affect change through health literacy and empowerment has led to a career focused on public health and a clinical practice in community-based clinics, as well as hospital-based academic settings. Dr. Hayes's leadership roles in several pediatric departments include serving as Chief of Adolescent Medicine for New York Presbyterian Brooklyn Methodist Hospital. She has also been an assistant professor of clinical pediatrics at Weill Cornell Medical College and an integral faculty scholar in health equity at the Cornell Center of Health Equity and Diversity Center of Excellence, Cornell University. Dr. Hayes's grants, research, publications, and presentations have focused on areas such as addressing chronic disease risk factors in minority populations and improving and integration of health equity and cultural competence into training programs across the entire spectrum of medical education. Thank you, Dr. Hayes, for being here. Would you like to share any words with us?
Yes, good morning, and thank you for the introduction, Elizabeth. It's great to be here with you all. As you mentioned, this is my first local early intervention coordinating council meeting, and I do look forward to at some point meeting hopefully all of you in person one day. You probably know that the Division of Family Child Health, which we call FCH, has a broad mandate to promote health and development of New York City's children's families, as well as parenting people. And along with the Bureau of Early Intervention, there are three other divisions, I should say bureaus within FCH, and they include the Office of School Health, the Bureau of Maternal Infant Reproductive Health, and the Bureau of Administration. And our work touches nearly 2 million New Yorkers each year. So that's a large number of New Yorkers that we are hopefully impacting positively in their lives. One of the reasons that I took the role as Deputy Commissioner of FCH is because of the broad and deep commitment that not only the division has, but the Department of Health has towards equity. That commitment is reflected very clearly in all of the work and services that the Bureau of Early Intervention performs. And under my leadership, we will continue reaching out to communities of color, to provide information about how they can utilize the services as well as the importance of early intervention. We will also continue to form strategic partnerships with others committed to this work, and we're going to continue to fight to see that providers are properly compensated and incentivized to serve in communities that really and truly need them. And we're also going to continue to work with the New York State Department of Health to enhance service capacity. So I am glad to be here with you this morning. I will probably not be able to stay for the entire meeting, but I am going to hopefully hear about a lot of what's going on locally. And I do, as I said in the beginning, look forward to meeting hopefully all of you in person at some point. And before I close, I would like to wish all the mothers who may not be mothers, but are mothers in any other way, a happy Mother's Day. And once again, thank you for having me this morning.
Thank you so much, Dr. Hayes.
Thank you.
So before moving on to the approval of the minutes, I would like to share that on March 1st, 2023, Assistant Commissioner Ledniak and I were invited as guests on the Reset Talk Show, which was an amazing time. We participated in a panel interview about the early intervention program where Assistant Commissioner Ledniak was explaining what EI is all about, and I shared my story of my own child, and it was well received, and all the panelists had questions. We had a panel of doctors, nurses, church leaders, and it was a great opportunity to highlight the early intervention program and the importance of the services, and specifically we discussed issues on the stigma that we have in the Caribbean community. So it was a great presentation, and sorry, I pressed my mute button by accident. It was well received. So I don't know if Lydia, would you like to say anything else on the show?
Only that I was so happy that you joined me, Liz, to talk about your personal narrative in accessing early intervention services for Jordan, your son. And I think that it made a big impact to have you there with me, talking about your personal experience and directly talking about some of the barriers that you encountered in accessing early intervention. And I thought that it was great because the host and the panel wanted us to come back so that we could continue talking about this topic within the community because they thought that it was so important. So that's all I'll add. Thanks again for being there with me. It was great.
Yeah, my pleasure. Okay, so we will now approve the minutes from the last LEICC meeting. Will someone make a motion to approve the minutes?
I motion to approve the minutes.
Okay, thank you. Will someone second the motion?
I second the motion.
Thank you. Now please raise your hands to approve the minutes. We have the little hand icon at the bottom you can tap on. And Lydia will count the hands and state if the minutes are approved.
Thank you. Motion to approve the minutes is carried, and the minutes are hereby approved. Thank you all.
Thank you. Now we will move on to our next agenda item. We will have Lydia Ledniak, Assistant Commissioner, report on the SEICC report and the EI program updates.
Thank you all. So I will give a report of the March 9th, 2023 State Early Intervention Coordinating Council. As with all State Early Intervention Coordinating Council meetings, I have circulated all of the materials to the LEICC membership ahead of time so that you can do a full review. I also would like to note that all State Early Intervention Coordinating Council materials and recordings are now posted on the New York State Department of Health Early Intervention website, all the presentations. And so for those interested in doing a deeper dive into the information that was presented by the State Department of Health and the committees, I recommend that you take a look at those presentations. So for the purpose of the Local Early Intervention Coordinating Council, I will be going over what the State Department of Health provided as part of their Bureau updates. And I will be talking to you about the recommendations made by the Rate Setting Methodology Task Force. So the first thing that the State Department of Health provided a update on was the development of the telehealth guidance document. They indicated in March that a draft guidance document was completed and will be shared with various stakeholders in this quarter here, and that updated FAQs and an updated telehealth consent form will be released when the guidance document is released. And in fact, a draft teletherapy guidance document has been circulated to various stakeholders, including providers, municipalities, and some of the subgroups of the State Early Intervention Coordinating Council. I think that there has been a lot of feedback that the state has received on that guidance document, and I am very much looking forward to seeing a teletherapy guidance document released for New York State. The state also provided an update on two promotional campaigns. One was a provider recruitment campaign that ran through from November to February. And you see the dates before you on the slide, with the intention of recruiting additional early intervention providers into the state system. And then they are also planning a campaign to recruit families from underserved areas across New York State sometime in 2023. And obviously, we in New York City feel that we inspired that by a lot of our outreach and equity work. So we're really happy to see that happening. So the state also provided an update on the Office of the State Comptroller audit that was issued at the end of February of 2023. Overall, the report made 5 recommendations to New York State. One is to improve the timeliness of service delivery and understand why some families do not participate in EI. And I think that our New York City partners can offer the state a lot of feedback as to why that's happening, particularly around a lot of the retention work that we've all been engaged in for a number of years now. The other recommendation was to develop a more specific work plan related to child find activities, because there's apparently some inconsistency across the state. The next recommendation was to address disparities in access to early intervention services. The next one was to improve the accuracy of the provider directory. And then the last one was to expedite the release of the EI Hub. The state also provided an update on covered lives. As you may remember, covered lives bill was passed at the end of 2021, and it required that private insurers remit $40 million into a pool and that money is to be dispersed, half to the state and half to local governments. And as a result, providers would no longer have to bill private insurance for EI services, and those payments would be expedited. So it took quite a while for the state to initiate payments of the covered lives pool to municipality. And those payments did start trickling in for FY 2023. However, the all of the payments have not been made yet. So, we continue to obviously be concerned about that, and also thank you for everyone's support in advocating on behalf of municipal governments. The next update was about transportation and the transportation cost study. The State Department of Health has been working with the Office of Health Insurance Programs to implement the Medicaid Transportation Manager in early intervention as an additional transportation option for families who have Medicaid coverage. The update is that there are still certain protocols that need to be worked out with the Medicaid Transportation Manager in order to make early intervention settings, specifically and approved settings where Medicaid transportation providers would go. And so as soon as those details are worked out, the system and along with New York City will move toward implementing Medicaid Transportation Manager in New York City EI. And then in addition to that, the state is working on a state plan amendment to enhance the reimbursement to counties for school bus transportation. And we're very happy to see that is moving forward because it will help us to ensure the fiscal viability of transportation services to group providers. The last state administrative update was about early hearing detection and intervention, EDI for short. And there was a proposed rulemaking released on March 22nd, 2023. And there was a public hearing held on April 13th, 2023. Comments on those regulations are due May 22nd, 2023. So there is still time to submit comments for interested parties. New York City, we reviewed the regulations and we thought that the recommended language amendments were very strong. So we are not going to be submitting comments on that proposed rulemaking, but other folks may want to take a look at the language because I think it does impact certain, there are certain impacts on practice changes. So the next thing that I want to talk about is the State Early Intervention Coordinating Council's Rate Setting Methodology Task Force. So the Rate Setting Methodology Task Force is a task force of the State Early Intervention Coordinating Council, and their charge is to improve capacity and to incentivize the delivery of services in underserved areas across New York State. And so what I'm about to go over specifically are recommendations made by that group. Doesn't mean that all of these recommendations will be accepted or implemented by New York State, but they were recommendations made by the group. And I thought that given the outcome of the executive budget, that it would be important to go over these recommendations now. So the Rate Setting Methodology Task Force recommended an 11% increase for in-person services. They recommended that the state develop a rate modifier to improve service access for hard-to-serve communities. And I don't like the term hard to serve, but that's their term. I think underserved is proper, based on a list of established factors. And some of the factors that were discussed were a percent, the factors would include percentage of the population, excuse me, within the child zip code of residents living below the federal poverty level, such as 20% of the zip code below federal poverty level, the difficulty in finding service providers due to bilingual service needs, a need for therapists to travel in excess of a 20-mile radius, which is the federal allowable mileage rate adjusted each year. And I think that consideration is more for upstate counties, right? Because in New York City, we don't really have that 20-mile radius so much. but we certainly have some of the other factors. And then finally, the task force recommended that the state try to gather real-time data to assist the task force in an effort to recommend changes to the rate methodology, because as many of you may know, the current rate methodology was developed based on data gathered from the family court system, which was the system that came before EI. So the current rate methodology and the assumptions in that rate methodology are based on information from 1993. So it's been a while. So there is definitely a need to think about rate methodology. Those are the updates from the State Early Intervention Coordinating Council. Do any of the committee members have any questions or comments about that? Okay, thank you. I will move on to some program updates. So first and foremost, I would like to make 2 staffing announcements for the Bureau of Early Intervention. We are pleased to announce that Ms. Elizabeth Martinez has been named as the Regional Director for the Staten Island Regional Office, effective April 17th, 2023. Ms. Martinez's career in early intervention covers the span of 25 years of service, commitment, and dedication to the Bureau of Early Intervention and to the New York City Department of Health. Most recently in her emergency response leadership efforts for COVID-19 as well as monkeypox. Ms. Martinez joined the Bureau of Early Intervention as an early intervention official designee in 1997. Serving in the Bronx, in Manhattan, and in Staten Island. In January 2021, Elizabeth became the acting director of the Staten Island Regional Office, and the Bureau lovingly refers to Elizabeth as one of our weekend warriors for her work on weekends with our Bureau's community outreach team. I'm also equally pleased to announce that Ricardo Torres has been appointed as the Regional Director of the Early Intervention Manhattan Regional Office, effective May 8th, 2023. Mr. Torres started his career in the New York City Department of Health Bureau of Early Intervention in 2003. Since then, he has held various roles within the Bureau. In 2018, he stepped into the role of Director of the Office of Consumer Affairs. In that role, Ricardo cultivated relationships with community dispute resolution centers to ensure that mediation requests were processed timely and effectively for families seeking to exercise their process rights. During the COVID-19 pandemic, Ricardo worked to support families in the program during an endless stream of protocol and policy changes, while finding the time to serve New Yorkers in a variety of emergency response roles. Most recently, Mr. Torres has worked in New York City shelters as a site supervisor, leading a team of clinical and non-clinical staff to create linkages to care and provide on-site support for new New Yorkers seeking asylum from a variety of Latin American countries. So please join me in welcoming Elizabeth and Ricardo to their new roles. We are so fortunate to have them step into these leadership positions. And now you know who to contact in Staten Island and Manhattan if, there are any issues. So with that, I'm going to move into my very last update, which is an update on the enacted 2024 executive budget. Obviously very mixed. So the 2024 enacted executive budget did pass an amendment to the New York State Healthcare Reform Act, which this amendment was needed to implement the Covered Lives Bill that I just talked about. And again, it requires insurance companies to remit $40 million every year into the state's Covered Lives Fund, which will cover a portion of the cost of early intervention services 4 counties, and also the New York State Department of Health. Municipal and state shares are calculated based on the early intervention program expenditure not remitted by Medicaid for the latest 12-month period for which data is available. And that's just a really fancy way of saying we need to continue to collect insurance information, because if we don't, we're not going to get any reimbursement, right? So we still need to know who has what kind of insurance in order to be able to leverage those data to draw down those funds. This particular Healthcare Reform Act amendment establishes the fund from January 1st, 2023 to December 31st, 2026. And so additional renewals will become necessary in order to keep this reimbursement mechanism in place. The enacted budget did not include any rate increase for early intervention services. But what I will say is that for the first time, early intervention rate increase actually made it into both Assembly and Senate one house budget bills. And the Kids Can't Wait campaign was actually invited to provide testimony at the Joint Budget Committee on Health. I think that was a first. And also the State Early Intervention Coordinating Council did send a letter to the governor supporting a rate modification for EI. And so I think what I'm trying to say is that it might be disappointing this year, but I think we made, advocates made it a lot farther this year than in previous years. And so, I hope that we can continue to advocate for, proper support for this program. With that, I'm going to stop for questions. I don't see any. And I think, Liz, we're ready to move on.
Okay. Now we will have Nora Puffett, Director of Administration and Data, reporting on the data report, provider oversight activities, EI Hub update, and respite RFP.
Good morning. So we've got quite a lot here today, but starting out with our usual data report. So with referrals, thank you. So with referrals, now we've got a couple years out. It's really starting to look a little interesting in terms of the trends. So we've been talking about 2019 as our reference year, the pre-COVID year, and asking, are we going to get back there? Remembering though that 2019 was actually possibly the largest number of referrals we've ever had in a single year. So we had this huge drop into 2020, and then an increase in 21, and in 2022, we came within about 500 referrals of 2019. You can see here with data through April that we're probably not going to quite reach that level this year. And part of the question to ask ourselves is that the way we should be thinking about it? Should we be constantly referring back to 2019? And to talk about that, I want to look at this population box here on the next slide. Still referrals, but it's by race and ethnicity. And what I'm going to summarize for you is the fact that since 2019, the birth to 3 population has dropped 6%, or by 20,000 children. So we're not the same population we were 4 years ago, and we are probably going to want to readjust our expectations. Looking at this box, you can see that the largest drop was actually in the Latinx population, with small across white and Black, and actually a small increase among Asian, which is going to inform our thinking about referrals not only in quantity, but also about who we need to be working with. We continue to make some good, slow, steady progress with Black children, but we need to be thinking about, Asian children as well, who have always been the lowest referred, and yet we're seeing the population is actually starting to grow. So all this is going to inform some of our ongoing planning for our outreach work in the next couple of years. In terms of general services, remembering that services always lag behind referrals, what happens is something a little gentler. We didn't have such a huge drop, but the drop went on a little longer, and you can see that we are looking like we may be hitting a plateau here. And again, this question of what should we really be expecting to see given the what's going on with the New York City population. But again, what's heartening to us at the moment is the fact that we continue to see with both services and referrals, this sort of small, steady increase with the Black children who we have really been working to reach, and feeling really good about that progress, and that we can maintain that while we also start working with other children and really doing outreach in other areas. The waterfall here asks again, of all the children who aged out in the year, how far past referral did they get? Did they get to an evaluation? Were they eligible? Did they get services? And what we can really see here is that there's been a slight drop this year in getting to evaluation, but really not a whole lot of change across groups. And what we the message we get here is really that Black children continue to have the lowest rates of retention and receiving an evaluation. And so that tells us both that we need to keep up the work in that area, and also that it's not enough just to be working on referrals. We continue to think about how can we retain those children and make sure that they get an evaluation. And then switching hats entirely, Lydia just made my story for me, but I'll say it again. 10% of children do not have insurance, no. We continue to have an issue with insurance not being recorded for children with private insurance in NEICC. And as Lydia said, that actually really matters now as much or more as ever, because without data about current insurance enrollment, we have nothing with which to advocate down the line for getting more, or at least the same, but preferably more as the population changes, insurance funding with covered lives. So we need to have that information, and we continue to really encourage service coordinators to continue to collect it. And for agencies to really explain to their service coordinators why they're collecting it, because it's understandable, they're not clear, but really helping people understand this is for the long-term sustainability of the program. So that's the data report. Does anyone have questions? Okay. So now we're going to talk about provider oversight. And I believe at the last LEICC, you heard about the fact that we are going to shift into a 2-year monitoring cycle beginning in 2023. And so we'll only be looking at half the agencies this year. And we've only gotten in 10 reports released yet to date, but let's take a look at what we've got going on this year versus last year. So last year, we did not look at ISC. And the reason for that was that we had raised so many concerns about it that instead we took the time to really do some investigation and to try to come up for some material for the Service Coordination Professional Development Institute to really focus on improving ISC in New York City. You can see that OSC also a concern, and unfortunately services as a concern in the last year, where almost 40 and 50% of those areas, the agencies audited and then failed. This year, the distribution looks very different, and I don't want to take too much from it because it's such a small sample size so far. It will remain to be seen. However, we have added ISC back into the mix, and you can see already we're seeing, the significant concerns. That again is almost a 50% agencies failing on ISC. So we'll continue to have more to say about this as the year progresses and we've looked at more agencies. Does anyone have any questions about provider oversight? Okay. So the hub, the EI hub, which has come up, but we haven't really talked about it in its own presentation for a while. So we all know the EI hub is what's going to replace our current case management and billing system, NEICC. It's been coming for a long time. I can tell you that we still don't have an implementation date, but we've been told it'll be this year, and we've been told it'll be given 2 months' notice. We've been trying to get ready for it in many ways, working in a sandbox, documenting the functionality, and starting to modify our own policies and procedures. What you're going to see is that because we know 2 months is just not enough advance notice to be prepared, and the next month over the summer, we are really going to start to rev up and make the assumption, just make an assumption that it's coming in early fall and we need to be ready. The first place we work on that is in the sandbox. You remember that was rolled out last August, and the state encouraged all providers and municipalities to get in there and work in the sandbox. And a lot of people had challenges, a lot of challenges setting up their roles, a lot of challenges working the system. There was not much documentation released. And I know many people went into the sandbox, had a lot of difficulties and said, no, I'm going to step out. Many, many thank yous to those providers who have stuck with it and who have worked cases with us and have dealt with PCG and gotten answers. And really, you have been so helpful. And we are really going to start encouraging more people to come back. We are much further along with the sandbox than we were last August. We do have more write-ups and assistance to give about how to navigate the sandbox itself. And we really encourage people to start thinking about that because, again, you don't want to wait until they announce that it's coming in 2 months. It's not enough time. So PCG has continued to release more information on their learning management system. I'm happy to say that I know many providers have communicated with PCG. We've given them a lot of feedback. They've made changes, and I will say they've really made some changes that we really needed. So we said to them, hey, the way ISC is structured in the sandbox does not work for New York City. It assumes that the EIOD is the ISC. And that, really the workaround would have been tremendous. And they really heard us, and they actually stepped back and did what I think was a very significant restructuring of the way SC is handled in the hub to make it better for New York City. So they definitely have listened to things we've said. Right now, what's going on at the state level is that PCG is testing migration of the data from NICE to the hub. We are all really happy that they are migrating the data because if you remember, they did not migrate kids' data into NICE, and that was extraordinarily difficult operationally. But migrating data from one system to another that's not a one-to-one is difficult, and they're being very cautious about it. So what they've started doing is testing with users to say, can you see the children you should? Can you see any children you shouldn't? Can you see the data you should? And does that data look correct? They've done that with us, the municipality, and they are working on getting ready to do that with a group of providers in New York City and across the state. And they have said that after that, they will start to move into some more user acceptance testing. I'm not sure what the user acceptance testing will look like at this stage in the evolution of this system, given that they are saying it's going to come within a few months. What I think all of us in New York City should really focus on is trying to use the sandbox now. We are really going to be making a big push on this over the summer, really encouraging people who did not get in to try again. We really encourage all providers to think about that, to look at it, to reach out to PCG if they have questions. PCG is very responsive, and we can share our resources there with anyone who is interested. But we are really encouraging everyone to sort of look at this as, we should really think about this as the pre-launch and be getting ready so that when we have the 2 months notice, we already have staff with a fundamental understanding who can help other staff learn and can create the documentation and the policies. Does anyone have questions about the hub? I'm either answering all the questions or I'm very boring. All right, last one. This is something we don't talk about much at all, but we're going to talk about respite. And I think that there can be a lot of confusion over what is respite in EI. Some people have never heard of respite. Some people know it from other systems where it may have a very different meaning. So there is actually a regulatory definition of respite, and it is temporary relief from caregiving responsibilities for caregivers who may be overwhelmed by the responsibilities necessary for a child with special needs. Okay, these are folks who are under many stressors, who have very limited resources, and children with a lot of needs. And this respite is provided by either a home health aide or a nurse, depending on the child's medical needs. It can be provided in the family's home, it can be provided somewhere else. And it's just caretaking. It's not therapy, it's not education, it's meant to give the parent a few hours break. Now, you may be surprised to hear that we contract for respite. But when 2013 reforms happened, the municipalities were left to contract for 2 specific service types, and they were transportation and respite. And that's because those tend to be very, very localized, and the agencies that do them usually aren't EI specific. It's a fee-for-service model, and this spring we've released a request for proposals to identify 1 or more new respite vendors. They can propose for all of New York City, they can propose for 1 borough, we'd like to see at least 2. And we're releasing it's 2 different solicitations, 1 for home health aides and then 1 for nurses for those who are doing specialized care. And the proposals are due May 17th, which is next Wednesday. We have definitely sent this information out to EI providers, but it is not too late if you're still thinking about it or hadn't heard about it. You can go on the city's passport site and see the solicitation and make an application. The minimums for a respite provider is that they've got to have 3 years providing respite to children under 5 and 5 years providing in-home respite to families. They've got to have language capacity for the boroughs they're offering to serve. And they need to have basic infrastructure to supervise the staff, to accept service authorizations in NICE, and to conduct fee-for-service billing. Now, we've had our current vendor for a long time. We have a lot of experience with respite. So for this solicitation, we really tried to think about what were the challenges we'd experienced and how are we going to address them. So, of course, the biggest thing we always heard was, oh, your rates are too low. So you're going to see that we have raised our rates quite a lot. And I'll share that in the next slide. We also heard, as always, about the hard to staff neighborhoods. And we decided, okay, well, this is our rate structure. Within New York City, we are allowed to have a structure that incentivizes as long as it's standardized. And in this case, we decided to say, here are the zip codes where children wait the longest. When they're authorized, it takes the longest for them to get the service. We will pay you more to serve those zip codes. And then finally, the other side is for us to work with families and to, instead of just saying we're authorizing you for 40 hours of respite, to really talk to them about it as like, what would that look like as a schedule? Because when you're talking to home health aides and nurses, they want a consistent schedule. And sometimes families are not thinking that way. So we want to sort of set that expectation up front. But I will leave you with the actual rates. This is a 9-year contract, and the rates will be adjusted every 3 years. The option 1 rates, which start at $36 an hour right now, that is almost 30% higher than our current rate. The option 2 rate, which starts at $90 an hour, and that's for the nurses, is almost twice our current rate. And there's an $8 or $10 surcharge, meaning that's that extra money we will pay you if you're going to a zip code where we just never seem to be able to staff on time. So we are hoping that these are pretty robust rates and that we are going to see and we'd really like to see a number of proposers, possibly from different fields, ideally from child serving fields. It would be great if EI providers who maybe do home health or health homes, really wanted to apply as well, because there is a learning curve for other respite providers around EI and EI families. So we're very hopeful that we will really get some applicants and have choices and wind up with some really high quality vendors to cover the city. And that whole process of selection will take like 3 months, and then there won't be a contract for another year. But we're very optimistic that this is going to turn out well for us. So any questions about respite or the RFP? Okay, thank you so much.
Thank you, Nora. And now we'll be hearing from Mary Elizabeth Vachon, evaluation specialist. We'll hear about the ACS BEI collaboration.
Hi, thank you. Good morning, everyone. Again, my name is Mary, and I'm here to give a quick update on initiatives between the Bureau of Early Intervention and our partner, the Administration for Children's Services, or ACS. So I will start by just describing the goals of the ACS and BEI partnership. Public health law and regulations governing the early intervention program indicate that children involved in substantiated cases of child abuse and neglect are considered at risk for developmental delays. For this reason, children in foster care should be referred to and followed by developmental monitoring. If the child has a diagnosed developmental delay, disability, or the parent or guardian has concerns about the child's development, the child should be referred directly to EI for an evaluation. The Bureau of Early Intervention is responsible for working closely with ACS and foster care agencies to make sure that children in foster care are monitored for any developmental concerns, are evaluated for EI, and if found eligible, receive services. This includes supporting children in foster care aging out of early intervention and transitioning to the Committee on Preschool Special Education or other early childhood programs. We have been working closely with the ACS team and the Office of Education, Support, and Policy Planning on a number of initiatives. Today, I will provide updates on the following initiatives. Enhancing the ACS BEI data report. This monthly report provides the status of children in developmental monitoring, or the EI process, to foster care teams. And we are delivering training to foster care teams in how to use this report. Streamlining communication between the Bureau of Early Intervention staff, EI providers, and foster care agencies. Providing training to EI service coordinators and regional office teams on how the foster care system works. And other activities related to the findings from the focus groups and interviews that were conducted with the foster care agency staff, birth and adoptive parents, and foster parents. The first initiative is the enhancement of the ACS BEI data report and training. Since 2018, ACS and the Bureau of Early Intervention have shared data on children in foster care in the Early Intervention Program. Each month, ACS sends us a list of children in foster care ages 0 to 3. BEI matches the list to the children in DMAS, the Developmental Monitoring Data System, and NICE. We send the report back to ACS, who then sends it out to 24 foster care agencies. Over the past few months, ACS and BEI collaborated with advocates for children and their working group, which includes representatives from foster care agencies, to revise the data report so that it's easy to use and recommended actions are clear. The report provides a status for each child and instructions for follow-up by the foster care case planner or education specialist to support the child in developmental monitoring or through the EI process. ACS monitors foster care agency follow-up on cases and receives updates from each agency on actions taken for cases coded as urgent. These include children who are in foster care but were not referred to DM or EI, children who were referred but haven't had an evaluation, children who were found eligible but haven't had an IFSP meeting, and children who are turning 3 and need to begin that transition process. We have developed a training slide deck together and are scheduling training sessions with foster care agencies in how to use the data report. And we are working with ACS to incorporate the training into onboarding training for early childhood foster care agency staff. So here is a snapshot of how the data report looks when it goes out to agencies. The first column here is the status assigned to the child. Evaluation overdue indicates that this child was referred to EI 60 or more days ago and has not had an evaluation. This status is red and sorts to the top of the report to alert the foster care team that follow-up action is considered urgent. The second column here provides step-by-step actions for the case planner to follow. Columns to the right, which are not shown here, include EI information, the NICE ID, date of referral to EI, the name of the last service coordination agency and service coordinator, etc. EI regional offices often receive calls from foster care agencies inquiring about a child's case. New York City BEI has reviewed and refined communication protocols to utilize the available data about foster care agencies to provide needed information about case statuses while maintaining the confidentiality of information. The enhanced protocol will be implemented across regional offices. So when a caller identifying as someone from a foster care agency inquires about a child, regional office will have access to the names of the case planner and education contacts at the foster care agency. Regional office teams will check the operational dashboard to verify if a caller is affiliated with the child and the foster care agency. If the regional office cannot verify the caller's affiliation with the child, and the foster care agency using NICE or this dashboard. The protocol directs the Bureau of Early Intervention's Consumer Affairs Office to communicate with our ACS partners to confirm the caller's affiliation. If the caller and affiliation with the child cannot be verified, they'll be asked to complete a consent form in order to receive information about the child's case. So here I'm going to show you, this is the operational dashboard, just a snapshot of it. When you click on the foster care tab here, you will see a list of children in foster care known to early intervention. The foster care agency name, the case planner, and the agency, education contacts for that agency who would be affiliated with the child. The regional office team can use this to verify identity of the caller and the affiliation with the child. So there were a number of findings from the focus groups with the foster care agency staff, birth and adoptive parents, and foster parents that have informed these initiatives that I'm telling you about. Among the findings, we identified a need for foster care staff and foster parents to better understand EI timelines. In addition, findings indicated that EI service coordinators would benefit from a stronger understanding of how the foster care system works. We are very excited to share that our ACS partners will be presenting a training that provides an overview of the foster care system called A Collaborative Approach to Early Intervention Services. Parents, service coordinators, and foster care agencies. The training will be presented to service coordinators as part of the Service Coordination Professional Development Institute series. This is occurring on June 27th. In addition, ACS will present this training to regional office teams and other EI staff on June 30th. And we are planning to record the training so that it can be available as a learning tool in the future. A common theme across the three focus groups with foster care agency staff, birth and adoptive parents, and foster parents was the stigma related to having a child with special needs. There was concern that referring a child to EI may result in the child being labeled as special needs or placed in special education for the long term. And this concern delays referral to EI and the initiation of services. We also heard that foster care medical staff are considered trusted messengers by families. Just this week, our EI medical director, Dr. Kathy Canary, provided training and resources to foster care agency medical directors on May 9th, which was received very well. In the training, Dr. Canary discussed focus group results, emphasized the importance of intervening early and the effectiveness of EI, and shared resources on how to help parents talk about their concerns. To address focus group results indicating that foster parents lacked information about EI, we regularly send the flyer, It Takes a Village. This is the workshop that we regularly host. We send this to our ACS partners so that they can invite foster parents to join the workshops so that they can learn more about EI. To make these efforts more sustainable, ACS and foster care agencies are discussing adding EI content to foster parent trainings. Finally, communication between the child's foster care and EI teams is critical to supporting the child through the EI process. Permission is needed from the parent to allow email communication between the child's foster care and EI teams. We are currently finalizing a joint letter from the Bureau of Early Intervention and ACS regarding use of the parental consent to email by EI service coordinators and foster care agency staff, and plan to distribute the letter to EI providers and foster care agencies as soon as it's ready, which will, once it's signed by the parent, this will allow that email communication to happen between the teams. Thank you for listening to my updates, and if anyone has any questions or comments, I'd love to hear.
Okay, thank you, Mary.
Thank you.
Thank you. Now we will have Vanessa Burrell Warner, Outreach and Training Specialist, present on the BEI outreach activities.
Good morning, everyone. I'm presenting on the Outreach and Staff Developments Unit, Community Engagement Activities within the 5 boroughs of New York City. So the Outreach and Staff Development Unit aim is to increase equity and access to the early intervention program for all New York City families. In the past, we have focused on increasing the number of referrals and family retention, particularly among Black and Latinx families, to pre-pandemic levels. Our hope is to do this and achieve this goal by our expansion of outreach activities. So early intervention outreach activities have in fact expanded for 2023 compared to 2022 to include additional zip codes in Brooklyn and expansion in East Asian communities. Examples of these outreach efforts are community detailing, healthcare participation, medical outreach, presentations, and interagency collaborations to expand targeted population reach. Outreach staff development, outreach activities really thrive on community engagement. Community engagement is in the form of our virtual and in-person presentations. For our virtual presentations, we have reached 423 providers and 111 parents through our It Takes a Village parent presentation, totaling 534 individuals. We have also participated in health fairs through tabling, and tabling has been conducted at WIC centers, libraries, hospitals, and participation at community events, reaching a total of 1,653 individuals. Community partnerships activities involve networking, interagency meetings, community detailing through flyers and brochure distributions, and we have reached 139 individuals, and that is for a period of January and April of this year. Overall, for the period January to April 2022, we have reached 1,462 individuals, and for the same period this year, we have reached 2,326 individuals, which represent a 59% increase in the number of individuals reached within the same period. Our early intervention presentation flyer. The Outreach and Staff Development Unit outreach uses, as mentioned before, our virtual parent presentations, which involve emailing this EI presentation flyer, which do have an embedded QR code and a web link option via community partnerships. It also includes a mass texting of our presentation via our Text the Families program, and community outreach, where we distribute hard copies of the flyers, which provides a very great opportunity for on-spot registration. Some noteworthy sustained collaboration efforts. So to maintain EIP's presence, Outreach and Staff Development Unit continues to establish sustained collaboration, and these are done through participations in community events and activities, such as our annual citywide baby showers hosted by NYPD and NYCHA, and other baby showers hosted by Empire Blue Cross and Metro Plus. Collaborative presentations are also done and continue to happen with ACS Safe Sleep program and tabling and presentations at the New York City Child Care Resource Referral Consortium and at libraries as well. And in the libraries, we do tabling at our children's programs, such as the Mother Goose program. Tabling also continue at pediatric, OBGYN, family medicine, outreach and inpatient clinics, waiting centers, and hospitals. Some of these hospitals include Brookdale Hospital, Kings County Hospital, Jamaica Medical Hospital Center, and Queens Hospital Center, either weekly and monthly. OSD continues to maintain EI presence through community partnerships with networks such as ECP, which is Elmhurst Community Partnerships, JCP, Jamaica Community Partnership, and East Flatbush Community Partnership, EFCP. This brings me to the end of my presentation. And at this time, do you have any questions? I'll be happy to answer it. Thank you.
I don't see any questions. Thank you, Vanessa.
Okay, thank you very much.
For that great presentation. I think that, you know, I really wanted to highlight, you know, our outreach unit's efforts, because we thought that it would be a really good starting point to our next series of presenters. Liz, would you like to move us along?
Sure. So next we will have David Harrington, Executive Director, and Danielle Herring, EI Ambassador for United of Brownsville. They will be presenting on United for Brownsville impact data and deepening family engagement around EI.
Thanks for the introduction and good morning again, everyone. I'm David Harrington. And can we go to the next slide, please? So United for Brownsville is a family-led collaboration transforming the early childhood systems in Brownsville, Brooklyn, so that all young children are able to flourish. And I would really enjoy being at these local early intervention coordinating council meetings and this collaboration that we've enjoyed with the Bureau of Early Intervention and families and social service providers in Brooklyn. And we're now almost 5 years into that collaboration, and it's been really productive. So I and Danny are going to talk a little bit about some of the results of that collaboration, including showing off some of the work we've done with the Bureau of Early Intervention recently, and also some new directions for the work that Danny is going to speak about. Next slide, please. And at the heart of the work really are two local stakeholder groups. One of those groups is the Family Advisory Board, or the FAB, and you can see a photo of the FAB in the top left corner. They're a group of mothers, fathers, and grandparents from the community who are experts in raising children there. And they drive our work, they set our priorities for change, and they collaborate with social service providers and other partners like the Bureau of Early Intervention to put those changes into work. The other photo on this slide is a photo of the Provider Action Team, which is a diverse group of educators, healthcare practitioners, mental health practitioners, and other social service providers working in the community. Next slide. Before I go too deeply into this, I'm going to throw a little bit of an audible because Danny has to go for her son to receive an award. He's a high school senior. So actually, I won't do this slide right now, and I'll hand it over to Danny to talk about her work as Early Intervention Ambassador and some of the new things that she's been doing there to expand the work that we're doing.
Hello, everyone. Reason why I'm in car meeting today, my son is receiving his award, so thank you for having me for the first time. I'm excited about being here. So the Early Intervention Ambassador role was created because the families had concerns and all the different things that they, had gone through. David will speak more about the history. But coming into this space, early intervention is truly about the children, but we cannot do anything with the children without the parental consent. So what I recognize is that with early intervention, connecting with the families and meeting them at a place of relationship and trust to be able to empower them has really helped the progression of early intervention in this space. Because not only did families not really understand what early intervention was about, they didn't know how to go through the process because when you don't understand something, you don't know how to partner with it. So what I came into the space and did was empowering families so they feel like partners and CEOs in the process. And now when families have the knowledge and understand, they are now informed and can make informed decisions. And things happen in life, and although we have systems and although we have structure, sometimes things happen in the process that we don't account for, that we don't like to happen. But in building the relationships, families were able to not just go through the process, but they were able to hang on in the process because of the communication, because of the trust, and because of the relationship and engagement that is built. Families now saw early intervention as a VIP service, and they saw themselves as CEOs in the process. Because of this, not only were families became advocates for themselves, but now we recognize that actually starting the process with early intervention and the families being engaged, we recognize that the communication is what was missing. The communication where people felt like you saw them and you were speaking to them. Something that I definitely use as a tactic is I don't ignore stigmas. I don't ignore experiences. I actually acknowledge them and I replace it with information that is positive instead. Instead of a lot of families came to me and it was like, I don't want my child to be labeled. And I break it down into it's a category, not a label, because label has a different stigma. Categories help you to address exactly what that child is dealing with. So in changing and normalizing the information and connecting it to families, they were actually able to walk through the process, because a lot of families don't even know what developmental delays or developmental stages are. I have to say, are they walking? Are they talking? Normalizing the language. And when I was able to connect that way, families began to trust me, community began to trust me, and now we can walk hand in hand while their voices were actually growing in the process to become exactly what I'm here to do, is to advocate. And because of that, we recognized that communication was the key, and we decided to put together an EI and early intervention working group, because if that is something that is working for us, it's something that everyone needs to know so the families and the children can get exactly what they need. And David, I am finished.
Okay, thanks, Danny, and congratulations to you, and go get that award.
Bye, guys.
Okay, I'm gonna go backwards a little bit, but we'll bring everything full circle. And one really fun thing that happened this spring was that we got to go with Lydia and Kelvin Chan from Robin Hood to South by Southwest Education to present on the partnership that United for Brownsville has had with the Bureau of Early Intervention and some of the successes we've seen locally. And those started with folks like Ruth, who is one of the family advisory board members, who's in the picture with me and Lydia and Calvin from South by Southwest here, as well as continuing with the work that Danny was speaking about. Next slide, please. So at South by Southwest, we did some background on United for Brownsville and talked about how United for Brownsville works. And I'm not going to go through all the steps of this slide, but this slide does encapsulate sort of the participatory approach I began to talk about with bringing together the Family Advisory Board and the Provider Action Team, who identified barriers in early intervention, forming a relationship with the Bureau of Early Intervention, who helped us get data to see what the inequity was. And we've been working through that data that we continue to get from BEI and trying different approaches in Brownsville over the last few years to see if we can move the needle on equity in the community. And one of those strategies we've tried is early intervention ambassador, but there are a whole bunch of other strategies too. Next slide. And this slide looks at the change in rate of EI referral from Brownsville versus New York City from 2018 to 2022. And you can see in the orange there that the rate in Brownsville started far below the citywide rate of referral, is now far ahead of the citywide rate of referral. Next slide. And then because we noticed that there was particularly an inequity for Black children and their rate of referral to early intervention, we really wanted to highlight that and make sure that we weren't just doing efforts locally that would bring up the overall referral rate, but would particularly impact the Black referral rate. And you can see we've had some success there also. So the Black rate also started below the citywide rate, has now surpassed the citywide rate of referral. And having this data to work on over the last 4 years has been really, really impactful and powerful, because it's let us know if what we're doing locally is having an effect across the neighborhood and keeping pace with the rest of the city. So it's been really powerful. And then another thing we highlighted in our presentation was how our efforts fared during the pandemic. And one thing you can see here is that everyone across New York City, as you well know, had a dip in referral to EI during the pandemic. But it is notable to us that the dip in Brownsville in orange was less than the dip citywide. And then our recovery everywhere has been good, but the recovery in Brownsville has also been very good and has actually exceeded the pace of recovery in New York City. So these are things that we're really proud of, because they represent an impact that we've seen and a change in the culture that we've seen in Brownsville, where we have so many families and so many social service providers all forming a community around early intervention and tracking the data and changing practices to try to bring equity to that. Next slide. But that doesn't mean that our work is done. And we have, we still have some difficulties with getting children through the multidisciplinary evaluation stage. So the Brownsville rate here is in black, where you can track the blue for Black children in Brownsville. And you can see that that's lower than the rate of completing MDEs in New York City, which is in yellow and continues to be the case. So that's something that we're really working on, that we think Danny can definitely have an impact on, but also if we're able to take some of the strategies that we know that Danny's working with families that have been successful with her clients, and get those strategies into the hands of other practitioners, other referrers to early intervention in Brownsville, whether they work in education settings or healthcare settings or social service settings. If there are more people applying the same tactics that Danny applies to help families navigate this process, I think that's how you get children through the multidisciplinary evaluation stage. And so we distilled those practices over the last year in the early intervention equity working group that Danny discussed. And so we're training people now in different settings, including working with service coordinators through the Bureau of Early Intervention. And we're really excited to see the next phase of that work, which is building a bigger practice of folks who are trained in Danny's practices and seeing the impact that that has on the evaluation rates in Brownsville. And I think I'll end it there.
Thank you so much, David. Obviously I'm really excited about all the progress that you have made with all the parents in Brownsville and the providers. I think that ultimately, I think that I think your model is one that can be replicated. Not the interventions, right? Because the interventions will be the proper interventions for that community, but the approach and, the utilizing data in a strategic way, building community around that. I think that that is a model that, can really work. And I'm kind of trying to set it up for Carlos, who's going to come next. But I'm just wondering if, Liz, you have any reflections, or anyone else on the LEICC have any reflections on David's presentation?
I definitely do. I want to say that from a parent perspective of having a child in EI, Danny pointed out one thing that really hit me was trust. And sometimes it's hard to trust that your child is going to be taken on as a child, not as a number, not as, this a part of your program and getting statistics on them. And I think a lot of us as parents think of it that way, even to piggyback on what Nora was talking about with insurance information. You think of, oh, when I put it, then they're going to track me, and they just want to keep tracking my child. And to get that kind of thinking to change is really critical to trusting the process, trusting that, your child is valued, your child, they see your child as being a person, and thank you so much for all your work. I remember when the inception of this program, I was excited, and I'm so happy to see all the progress and what you're doing in Brownsville, and I can't wait for it to be in different areas also. So thank you so much for your work.
I just wanted to add that, the ACS education team, we're really trying to support not only the foster care agencies, but the rest of the agency and a lot of the things that you guys have been doing, making a lot of progress on. And we'd love to talk more and learn from you guys and any way we might be able to collaborate or support. So thank you so much for your presentation, and Danny too.
Thank you. I'll definitely be in touch, Christopher.
Yeah, I think that there's definitely a lot of possibilities with other systems. I think that, and particularly, we've been obviously in this space, we talk about early childhood, but I think broadly, there's a lot of application for this model to resonate, to address other health disparities and inequities that we see all across our city. So I think anyone on this LEICC, I think would be really a good person to speak with, about the United for Brownsville work and their model. So.
Thank you so much, David. So we will be moving on. We will hear from Carlos F. Rosales, Senior Community Outreach and Engagement Associate for Citizens Committee of New York, presenting on the Open Leadership Collaborative update on local efforts on early intervention equity.
Great. Thank you, everyone. Thank you, Lydia, Nora, and the rest of this council, and also shout out to David and Danny at the United for Brownsville team, because seeing the success of that, not only in terms of the outcomes, but also the partnerships that have been developed, the relationships with communities, providers, and with the DOH BEI team to really drive the success that's been seen in Brownsville. It's something that resonates with us, because we are this group working in coordination with United for Brownsville and BEI to really take the success that's been seen in Brownsville and replicate that, of course, being conscious of each individual community needs, and see how this approach can be applied to various other communities in the rest of the 5 boroughs. On the next 2 slides, I'll just start by sharing a little bit about our organization and who we are. So Citizens Committee for Children of New York, or CCC, is a child advocacy organization. For the past 79 years, we've been combining public policy research and data analysis with community action to ensure that every New York child is healthy, housed, educated, and safe. And we do this by 3 pillars of work: advocacy, so that way we drive legislative and policy change from the local to the state level, and sometimes federal, depending on the issue. We have a robust research and data team that supports fact-based advocacy that pulls data from anywhere from community voice to the census, administrative data at the city and the state level. And then, of course, the team that I'm part of, the civic engagement team, that works to mobilize families, young people, and New Yorkers across the state on various issues that we advocate for. So the next slide, I'll just share a few resources. You'll have this afterwards, or it could be put in the chat if possible, but we have a number of resources around child and family well-being, more broadly speaking, including our New York State Child and Family Wellbeing Index, our Keeping Track data book that's released every 2 years, a recent ECE report on a path towards universal early care and education in the city, and then our database that pulls municipal and census data on child and family well-being indicators, including indicators related to EI. And then on the left and the right side, you'll see a number of EI-related resources, including a fact sheet that was recently published earlier this year, and some reporting and posts that we've created to address the issues from both local level and advocacy level. So moving on, I just want to briefly recap who we are and what we're doing for those who weren't at our last meeting when we presented in the fall. We are working with United for Brownsville and New York City BEI and several partners that you see on the next slide across the city, including in Northern Manhattan, the North Shore of Staten Island, Hunts Point, and the South Bronx, really to increase and make an impact towards demographic and communities where we see disproportionately low impact from the sense of referrals and retention within the enrollment process. And so, like I mentioned, this is in partnership with New York City's Bureau of Early Intervention team. You'll see on the next slide that they've really provided with us data and outreach resources so that way we could work to analyze and support partner organizations doing this work and get information at a zip code level. So like in Brownsville, it can both inform the planning as well as tracking of progress on various interventions that communities are taking place and implementing in their own spaces. The next slide just shows an updated timeline, but we're, I think, in the middle of the first year of this effort. Last fall, we began the various communities I mentioned to conduct community-wide outreach, build relationships with parents, caregivers, and families, recruit partners and stakeholders, and begin identifying resource needs to support this work. And from there have held community and stakeholder conversations, build these relationships so that way we can work with them to identify needs, barriers, and solutions. And now this year, we're beginning to see increased movement in towards the work as these different partners and communities and families are identifying and implementing their own community-driven strategies, so that way they can make an impact to achieve EI equity for Black, Latinx, and other community members in their neighborhoods. So the remainder of the time, I just want to highlight really two cases, one from the North Shore of Staten Island, and the other with our work happening in the South Bronx, as two examples of how these different partnerships and groups have progressed in this work. So in the North Shore, we're focusing on the zip codes of 10302, 10303, and 10310. You'll see in the next slide that last year, because their geographic area encompassed many more than 3 zip codes, we went through this process of narrowing down and identifying 3 zip codes to focus on. And from there, the Staten Island Alliance has really integrated EI equity as one of the pillars and goals within the work of the Alliance. They've integrated this work in various work groups that include providers, parents, and caregivers, including the knowledge sharing work group, a policy and advocacy work group, and an early learn environment work group. Now you see that depending on the work group, they've begun to engage in a number of different activities and interventions that begin this process of really addressing disparities and needs around this critical service. You'll see in the next slide that the community, this partner has begun to hold community conversations. They have an aim of about 3 to 4 in each zip code, but understanding what those needs and barriers are, so that way, as they kind of conclude this phase of working with parents and caregivers to understand what is happening, compile those findings to share out, and then connect with EI service providers to identify what are the supports and what type of action we all in the North Shore of Staten Island can do to increase the supports. These also have been focusing on compiling relevant EI resources, including adding these resources to their own websites and some of the infrastructure that they've been working on more broadly as an alliance. They've also begun to move towards a collective effort between the different partner organizations to share and provide EI resources and supports. And in the future, we'll be sharing some information with BEI and DOH to share what some of those findings and the progress of these initial activities result in. Now, to highlight, some of what emerged from initial sets of conversations, because they are still working on engaging families and caregivers in these different community conversations. Two key themes really emerged from those conversations so far. One is needing supports around to address parent and caregiver lack of knowledge around EI services, especially in relation to who can refer a child to EI services and the various resources that families or parents have to support that process. And, there's some sub-themes that emerge from this, from not having a full understanding that 311 is also a resource that they can utilize, not knowing that parents can refer their own child to receive EI services, and then, other identifying barriers in which, in consulting physicians or pediatricians, that really persistent advocacy is sometimes needed because in some cases, families felt like they just weren't heard, or there was a lack of urgency from their own physician in referring or supporting that family in identifying if they do need EI services. Then on the other side of things, considering from the EI provider, the EI expert side, families identified, just challenges around lack of services and urgency in receiving services. So as we heard, I think in previous presentations already today, not providing in-person evaluations at certain zip code areas, significant delays in services, and not receiving services in child care programs or settings where their child and the family is already at. In the next community in the South Bronx, focusing on the 10456 zip code, 10459, and 10460, we see a number of different activities, a little bit different, but similar in themes to what we see with the Staten Island Alliance. Recently, in the next slide, you'll see that two key activities have been the formation of their early childhood collective, which is a mixed group of providers across these different zip code areas who work towards deepening their impact of their organizations to break down siloing within the provider landscape, sharing resources and best practices among the group, and then supporting their own working groups, which are being developed right now to advance early childhood outcomes. Parallel to the formation of this group, the SBRT, or South Bronx Rising Together, formed a parent council of parents and caregivers, both English speakers and Spanish speakers, to share resources, provide parents and caregivers opportunities to collaborate, including leadership development for those parents and caregivers, which I'll get to in a moment, and create peer community supports that engage caregivers on issues and policies that are affecting their children. On the next slide, you'll see that some of the activities of these two groups, including training parents and caregivers to facilitate community workshops, so almost a peer-led model in essence, and they're piloting right now a parent and council-led community education workshop series that's currently ongoing and will continue to be run through the summer at least. They meet monthly as a group and quarterly as a collective, and are now thinking about developing a few additional pilots in addition to their community education workshop series, including a EI public education campaign, a peer navigator or ambassador role similar to what United for Brownsville has developed, but tailored to this community, provide education both towards families, but also different providers who could support EI infrastructure in their community, engage in advocacy campaigns to uplift common themes at the city and the state level, and then thinking about what other resource distributions they can provide to their community to support parent and family engagement in this work. There initially in their focus groups that they held, you'll see in the next slide that a number of themes have come up. They've categorized these 3 themes into infrastructure needs, environmental needs, and education needs. A lot of the common threads around these 3 categories include many parents and providers sharing anecdotal stories that they heard from their own parents said that they would not seek EI evaluation because of fear or stigma. And then parents said education from a credible voice or trust building process is necessary to address that fear. And sometimes includes not just a one-off interaction, but multiple interactions that break down that barrier. And then in some providers also shared that their lack of trust in parents to follow through with EI providers, to follow through with the EI referral process, indicating that they also shared a lack of capacity to follow their caregivers and child through the referral process and signaled some type of need for external support in guiding families and caregivers through that process. And so I just want to conclude by highlighting supports that we as an organization in this partnership and United for Brownsville as well as providing for these various communities and partners we're working with. On the next slide, you'll see that I think critical was identifying funding so that way we could provide to these partner organizations support around creating EI ambassador positions, support around data analysis and technical support to guide them through this process. And we do this work with support from BEI as well. Community advocacy and mobilization, as well as supports for parents and caregivers to participate in these initiatives. I think another area of support that is in development right now is guidance around developing shared community advocacy and uplifting community leads to local to larger advocacy initiatives underway. Some of them relate to the ones that we heard earlier. And then, of course, because of the wealth of information and experience that United for Brownsville has, they've stepped up in this partnership really to provide technical assistance, including community intervention design and passing on the lessons learned to these community partners that are just starting their journeys around these initiatives, helping support around project tool development and other strategic considerations for our partners. And then I think critical across the board in most of these communities is this desire and recognition that the EI ambassador role and developing that role has been a critical function that led to the success in Brownsville and will likely lead to impact in their own communities as well. So my last slide, I just wanted to share out, a reminder to all, but a recognition that United for Brownsville development of the EI ambassador role and these different elements that will support their own community initiatives have been critical to kind of what the next steps and what the next iteration of interventions and supports are going to be provided in these communities. So we share some of our contact information in the end. Please reach out to myself. You'll see my email there. Maria, who is our Senior Research Associate for Data Resources that works very closely with BEI, and then Jenny Velos, who is our Policy and Advocacy Associate, who we are bringing into this project as well to uplift local change and transform that into advocacy initiatives as well. So thank you.
Thank you, Carlos. And, now you can see sort of like the thread of Liz's statement that she made a long time ago of, when will we see United for Brownsville be in other communities? Well, the solution is it can't be United for Brownsville. They can only be in Brownsville, but there are other community organizations and collective impact groups that can do this work in their own way, right? But, we as the department need to continue to support these local efforts and support can take the shape of many forms, right? And so, I think that from a department standpoint, we continue to be very excited about this work. And I thank Carlos for continuing to move these threads forward. I think it's very difficult, particularly when you're working with multiple communities simultaneously. And so I think that you have made a lot of progress in a relatively short period of time, sort of carrying this work forward. So thank you.
All right, thank you.
Anyone
Thank you,
else?
Carl. Sorry.
I was just wondering if anybody else had any comments or questions for Carlos. Okay, not seeing any, and realizing that we are starting to possibly experience some web meeting fatigue. Let us move along. Thank you so much.
Yes. Okay, next we have Channing Edson, Senior Director of Early Intervention, Preschool Special Education and Inclusion, presenting on the New York City DOE Early Childhood Transition and other early childhood updates.
Wonderful. Thank you, everyone. I'll try to make this short and sweet because I am at the end and I know that we might be a little bit fatigued. And so a lot of this is, we don't have a ton of updates versus if you were here last time. So Lydia, if you can just go to the next slide. So some changes that we've had over this course of this year is that our early intervention team is now under the larger umbrella of early intervention, special education, and inclusion. And so this has brought multiple teams together to streamline the birth through 5 special education process. Not just here at the division, but here working along with early intervention, as well as working along with our partners at our SEO office, our special ed office. And so the early intervention team is working with our inclusion support specialists, who is an aspect of this team, who are working directly in our programs to provide targeted coaching and support both to our borough staff, so meaning our instructional coordinators and our social workers, as well as the leaders of programs and the teachers in the programs, to ensure that all children are being represented in our programs, and that teachers and leaders are building their capacity around supporting children with disabilities or children who are suspected of disabilities, as well as promoting a tiered model of supports so that there are more stopgaps in place before teachers want to run to referral. That referral isn't the first intervention that we're doing. Referral is the last intervention that we're doing. So really putting the onus on the adults in the classrooms and in our programs to be demonstrating the data of what they're doing to support these children in our programs. And so it's really exciting to have these two teams come together like this, because we really are having a birth through 5 process here. So that's been really exciting. And we're building, and as I said before, we continue to build our partnerships with we work really closely with the CPSC admins, meeting with them monthly, as well as our EI regional offices also have monthly meetings. So we're really breaking down those silos and creating more communication between the systems that we know can be so daunting for our families. As many of you have reported already on in this meeting, how hard it really is for families to navigate the system, and how often families just abandon it, right, because of the difficulty. So that is really something that that this team is trying to do. And one of the things that our early intervention team does is reaches out directly to families to provide them the support for that transition between between early intervention and CPSC. And so later I'll share our email inbox, as well as our helpline that I proudly explain that people answer. People will call and they will get a transition specialist, and that specialist will support them through this process. So we can move to the next slide. And so actually, I want to make a correction on this slide that we reach approximately 2,000 families a month. So we between the 10 regions, between the 10 regions, our transition specialists are reaching out to about between their different regions, reaching out to 100 families per the 10 regions, and so that they do this active outreach weekly. And again, this is with our partnership with Early Intervention, who provides us the information around the families that are beginning to transition or have the ability to transition. And so our transition specialists will reach out to these families individually to say, we are here for you for support. And we have folks on our team that speak Spanish, Mandarin, and Haitian Creole. So that's really exciting to think about, and to think about the support that, and as someone that sits next to them daily, I hear their support. I hear how empathetic that they are with these families. They really are listening and providing them with the different levels of support that they may need. And so, as I mentioned before, we're meeting with our regional EI offices once a month, so we can constantly have communication about the different things that we're working on, or different aspects of our work that that may need support. And working along with our service coordinators. And on the next slide, you'll see some of we have our document transfer system, and so, or DTS. And so this is a system that the service coordinators have access to upload all of the documents that they need to upload, that that then go to CPSE when a child is transitioning between the two processes. And so a huge piece of the work that our transition specialists do is check those documents, because a lot of times what's holding up these referrals is paperwork, is the red tape. And so our specialists are looking at all of these documents and ensuring that the documents are properly filled out to the best of their ability, to ensure that this process is moving along. And so this is a really important aspect of the system that ultimately feeds into a larger system where we can have access to the children's information that also our CPSE partners have access to, meaning our Fiat system. And so we provide training, right? We don't just say, like, here's the new system and go at it, right? We provide training for our service coordinators. They have their own inbox. So when they have technical questions, they can reach out to us. And that inbox is just for service coordinators. So there is constant communication between our team and the service coordinators. And then on the flip side, also with our CPSE admins, so that we are all working together to ensure that that our families and our children are getting the services that they're entitled to. And I just wanted to also highlight that we get the list of all of the children that are transitioning, but we have a special focus, a targeted focus on children in children in transitional housing, children in foster care, as well as children who are auto eligible. So of course we support all families, but they do have a targeted focus on those three categories of children, knowing especially the ones in foster care and the ones in temporary housing often fall through the cracks. So they really are targeting those families and caregivers to ensure that those children are not falling through the cracks. And then, so we provide these trainings for the service coordinators through different presentations, but they have a recorded presentation that they can access at any time. And so when we think about the turnover, that the EI regional directors have access to this. And so and that can share with the agencies. So as turnover does happen, which we know is inevitable, excuse me, they always have access to these trainings and don't have to wait for a live in-person training. And then we also have our family webinars. And so it used to be one long webinar that we have now broken up into 3 segments to help it hopefully to make it more accessible to more families, not only through the 4 different languages that we have it in now, which is English, Spanish, and Mandarin, but we also know that you can get fatigued while you're watching something for a really long time. So we wanted to break it up into 3 different aspects. And so we have that now. We've shared that with EI, who I believe has sent it out to their families as well. And so that this is a recorded webinar that families can access at any time. And as well, you can see here that this is our EI to preschool email that families or any of you or your colleagues can reach out to us that way. And we also have our helpline here. And these are just some important dates that are always good to remind families of, especially when they're thinking about a referral. So currently, children that are born in 2020 between July and December, that CPSE is accepting those applications for referrals. And so and then in December, we'll move on to children born in the year 2021. But right now, this is the time frame of the ages of children that can be referred for CPSE. And again, this is just our helpline and access to our different webinars.
Thank you, Channing, for that speedy update. Really appreciate it. Any questions quickly for Channing on the materials? And again, we really value the partnership that has been built between the Department of Health and the Department of Education over these last 5 years. It's been really wonderful, and I think that we get less complaints around transition now because we are collaborating well together and trying to streamline access for our children. And I think ultimately there's more work to be done, particularly around the children in foster care space. And hopefully we will be able to, all 3 of us, have an update for our LEICC on that over the next 4 months. So I'm very excited about the possibility of doing that as well. Liz?
Okay, so we do have, some subcommittees do have presentations, but due to time, we will hear from them at our next LEICC meeting. Do we have any public comments?
Do not have any public comments.
Okay, perfect. Okay, so I would like to adjourn the meeting. Thank you so much for all the information that we got. We had a jam-packed meeting, and I want to thank everyone for participating, and happy Mother's Day to all that are mothers or going to be mothers or are in the position of a mother. Right. Have a good day, everyone. Enjoy the weather.
Thank you, everyone.
Thank
Bye.
you, everyone. Bye.
Thank you.